What is turning your face red? Let's look at the problems and the solutions. Facial redness can feel very frustrating and the causes often seem mysterious. But the good news, understanding the problem can lead to real solutions. Let's break down the most common causes of a red face and how you can manage them effectively. Welcome back. I'm Dr. Maria Azizian, a board-certified general surgeon and IFM-certified functional medicine physician. On this channel, I share health tips on skin health, food and supplements, functional medicine, and the latest medical research to help you feel your best. And if that sounds good, please like, share with your friends, and subscribe. So, red face problem number 1. You have persistent redness, bumps, or visible blood vessels, and the issue is rosacea. Rosacea is a chronic skin condition that causes redness, flushing, visible blood vessels, and sometimes acne-like bumps. It is also called an adult acne. It is often triggered by factors like heat, spicy foods, alcohol, or caffeine, which dilate blood vessels and irritate sensitive skin. The solution: identify and avoid your personal triggers, be it spicy foods or alcohol. Protect your skin with broad spectrum sunscreen daily. This is not negotiable. Daily sunscreen all year round is an essential component of rosacea treatment. Use gentle, fragrance-free skincare products designed specifically for sensitive skin. One of the most classic treatments for rosacea is topical metronidazole that is prescribed in cream or gel form. Yet it's not always helpful. At our clinic, we focus at the root cause of the problem, such as eliminating the triggers, as this has been shown to be much more helpful than just a simply topical solution. Additionally, we put a focus on natural herbal topical agents. Red face problem number 2. Reactions to foods or skincare products, allergies or sensitivities. The issue is your immune system. Facial redness can occur when your immune system reacts to certain foods or ingredients in skincare products. In my book, The Clear Skin Diet: Unlocking the Secret Link Between Food Sensitivities and Skin Health, I go over multiple food groups that can cause chronic skin issues. Some foods such as dairy, gluten, and soy are known to be common offenders, and some others like eggplants and tomatoes, for example, are not well known to be the culprit of skin reactions. And there is a difference between food sensitivities and food allergies. The most important one is timing. Food allergies are immediate and easy to discern. You eat an orange, for example, and have a rash. However, food sensitivities are slow in onset and may take up to 72 hours to manifest. It makes them much harder to diagnose. If you eat the trigger food day after day, then you may have the same skin irritation continuously. And we see that in our clinic when we run food sensitivity testing and prescribe elimination diets. These food sensitivities lead to inflammation and visible irritation of the skin. The solution: keep food and product diary to track patterns. Try an elimination diet or seek food sensitivity testing to pinpoint these problem foods. Switch to hypoallergenic fragrance-free skincare products to minimize irritation. A functional medicine approach can help address this underlying inflammation because it's never just the skin. Red face problem number 3, sunburn. The issue is, yes, UV damage. UV radiation damages skin cells, causing inflammation, redness, and peeling. Even brief sun exposure can lead to lasting redness if your skin is sensitive and also if you are fair-skinned. Yet, the effect of sun damage is noted and happens in all types of skin. The solution: use broad spectrum sunscreen with SPF 30 to the face all year round. Reapply after 60 to 90 minutes in direct sun. Wear a hat and seek shade during peak sun hours. After sun exposure, soothe your skin with aloe vera or some gentle moisturizer. Red face problem number 4, flaky redness around the nose, hairline, or eyebrows. The issue is seborrheic dermatitis. Seborrheic dermatitis is a condition caused by an overgrowth of yeast on the skin, often linked to oily skin and dietary factors like sugar. It results in these red, flaky patches, especially around the nose, eyebrows, and scalp. There's often underlying fungal infection, I would say almost always. The solution: use antifungal shampoos or creams to reduce yeast growth. Avoid high sugar foods, which may exacerbate this condition. As I always say, yeast loves sugar. Red face problem number 5. Flushing after drinking alcohol. The issue is, yes, alcohol. Alcohol dilates blood vessels, causing facial flushing. Some individuals are more sensitive to alcohol, especially those with a genetic enzyme deficiency, ALDH2, and that leads to prolonged redness. Also, chronic alcohol intake leads to a chronically red face. The solution: limit alcohol intake and avoid triggers like red wine, which is the worst actually. It can worsen flushing significantly. Explore alcohol-free beverage alternatives and stay hydrated to help your skin recover faster. Red face problem number 6. Hot flashes and hormonal fluctuations. The issue is hormones. During perimenopause, menopause, or other hormonal changes, your body can experience hot flashes that cause sudden redness in the face, neck, and chest. These episodes are caused by blood vessel dilation in response to hormonal signals. The solution, I have to say, is not that easy. Of course, focus on hormone balancing strategies like, first of all, eat diet rich in healthy fats, leafy greens, and phytoestrogens. Practice stress management, as stress can worsen hot flashes. Speak with a functional medicine provider to explore options like herbal supplements, and of course, lifestyle changes to ease these symptoms. But honestly, that's not that easy, as we see in our clinic. It takes time. Red face problem number 7. Blushing from stress or anxiety. The issue is emotions. Emotional triggers like stress, embarrassment, or excitement can activate your body's fight or flight response, releasing adrenaline that dilates blood vessels and causes redness. The solution: practice relaxation techniques such as deep breathing, mindfulness, or yoga to calm your system. Try grounding exercises to reduce anxiety in the moment. If emotional blushing feels overwhelming, therapy or stress management coaching can help. So to summarize, a red face doesn't have to stay a mystery or a frustration for that matter. By addressing these common problems with targeted solutions, you can calm your skin and feel more confident. The key is really to uncover the root causes of redness. Some of it you can do by yourself, and some require help from your doctor, especially with the functional medicine provider that could help you with more natural remedies. Let me know what you think in your comments. Thank you so much for watching. Until next time. Bye-bye.